a lot of the things that I'm going to ask on the tibia. There are a few things that I do want you to know and be expecting to ask you of. Like, for instance, the tibial tuberosity, which is here where that yellow smiley face is. The medial malleolus, which is here. Here we have the anterior crest, tibial crest right here. Up here we have, of course, the condyles, which we have on the two sides here. So, of course, again, to identify the medial condyle, you have to look for something that's medial. Medial malleolus is on this side, which means that this condyle here has to be the medial condyle, and then this one has to be the lateral condyle. And then up here at the top, we have what are called surfaces or facets. And so these are going to be on the condyles as well. And then what we have in between the condyles is this little raised ridge area right here in the middle. And that's the intercondylar eminence again. So there's another one right there. Okay? Now, for the tibia, for the fibula, really we're looking for the head, the lateral malleolus, and then the anterior crest of the fibula. Now, excuse me. Now, the anterior crest of the fibula is visible when the fibula is actually turned to the side. You can see it kind of stand out right there like that. If it's turned like this, you're not going to see it. And if it's turned like this, you can kind of see a different ridge, but that's not the same as the anterior crest or ridge. This is it right there. Okay? And what happens is it sits underneath like that. And that's what happens. And so you see the anterior on both sides. And this fits around the talus. All right. All right. On here, obviously there are some structures that are just too easy to ask questions on, but certainly you do need to be able to identify, like the head and the neck. That is very easy. I will not ask that because it's just too easy. However, I might ask, for instance, this depression right here, which is the fovea capitis, okay, which is that, and that's what is connected to the acetabulum through what is called the ligamentum teres. Now, behind the neck, we have, of course, the greater trochanter and the lesser trochanter. And so this area right here in between the two trochanters is the intertrochanteric crest or ridge. So that's what that is. And then on the other side over here, we have, which is barely visible on a plastic one, but on a real one, it's really definitive. And it would run between here and here. And that would have been the intertrochanteric line. And the crest and the line are very helpful in identifying the front and the back, as well as the condyles here. And so the line would be on the front, and the crest would be on the back. Now, down here we have, of course, the condyles, which I just mentioned. You can see that they're curved backwards because your knee bends backwards, not forward. And so, of course, you have a medial condyle and a lateral condyle, and the best way to figure out which one is that is to go back to the head. The head is always going to be medial, so everything on this side is medial. Okay, so we have, of course, the medial and lateral condyles, and then on the sides here, on this side as well as on this side, is the epicondyles. So medial epicondyle, lateral epicondyle. Then here we have, of course, the intercondylar notch or intercondylar fossa, depending on which book you're using. We head upwards, and we can actually see that there's a line that comes up here and another one that kind of comes up here. And so these are, of course, the supracondylar ridges, medial and lateral. Okay, these two come together, and then they form this kind of area right here. And this, of course, is the linea aspera. And then if we follow the linea aspera further up, we have this large area here, all of this, which would be the gluteal tuberosity. Yes. Okay. Yep, that's it. Huh? Oh, you mean the tubercle, right? Is that what you're talking
I
about?
was going to say the patellar surface.
Oh, yeah, the patella surface, that's not a big thing. I mean, it's pretty easy. Patella surface where the patella sits. I thought you were talking about that little tubercle that you, yeah, there's a little tubercle there that I didn't mention.
What is it?
Oh, that's gonna be fun.
It's in the PowerPoints. The pictures on the PowerPoint.
So what are y'all trying to identify? Can you show me?
It's a little tubercle on top of the epicondyle.
What's that?
The little tubercle.
Where is it? What is it called? Little tubercle?
Where is
No.
it? Where is it?
What is it called?
Wait, what is it called, McCollum?
Right there. Where?
What is it?
What's the name of it?
Let me take a picture.
What is it?
I don't know what it's
Don't
called.
worry, I'll find it in the PowerPoint.
It's in the
You
PowerPoint.
think he's funny?
Only a bonus.
How he laughed at us at that test?
Okay, point to it one more time, please.
And I'm mad because I ain't even put nothing for it. Because I was like, whatever I put, it's gonna be wrong. So I just didn't put nothing.
What's up? You should always try. You should always try. Never, never, never not.
What was it anyways?
What
That
was
bonus number 3.
Yeah, what was it?
Unknown.
It's just a muscle, like it's basically a super scapular